Doctors, meanwhile, are feeling stressed after 2 waves of COVID. A third one has seen many warriors testing positive. The burnout is inevitable. Milan Sharma with more.
Over 2 lakh infections added to the COVID caseload every day. Despite mild infections, the surge is big enough to put pressure on India's healthcare system and the warriors on the front line. After serving sleepless nights in COVID wards in the second wave, Dr. Tanmay, a senior resident pediatric surgeon at AIIMS Jodhpur, tested positive on 5th January. He recovered from COVID and joined duty back on 12th, in exactly 7 days.
The impact of COVID, people are having weakness even after that. Some are having brain fog. So those implications that are there is gonna be there for the doctors as well. So the ones who are working in day in and out will also have to suffer the same things post-COVID as of what normal people are there to suffer. So doctors are facing this as well.
The staff crunch at some hospitals was serious. They were forced to impose harsh rules. The ESIC hospital in Faridabad laid down these rules for healthcare workers. Symptomatic healthcare workers will only test after permission from senior administrators. If they test again, they have to pay 1,500 rupees for every subsequent test. Only 3 days isolation for those who test positive. They need to report back to duty on the 4th day. The circular created a storm on social media. The hospital administration issued a rebuttal, saying they reviewed home quarantine policy for healthcare workers to avoid the total collapse of the existing healthcare system. The administration claimed it wanted to cap unethical and fraudulent malpractices to save precious resources. Further, the hospital authorities said home isolation for doctors shall be reviewed after 3 days and healthcare workers can resume duties wearing PPEs if symptoms have resolved. Doctors say such practices lower their morale.
Personally, मुझे बहुत बुरा लगता है जब इस तरीके के नोटिस आते हैं because it makes my morale down. It creates a mistrust between the authorities and मुझे लगता है कि यार हम पूरा इतना काम कर रहे हैं अपना ईमानदारी से ओवर टाइम कर रहे हैं. I mean, we deserve better.
It is just the mockery of the healthcare system of India, and it is the mockery of the policies. We are doing our work. That means that we are fooled that we are going to do our duties. We are going in the COVID wards. We are going in the seeing the COVID patients where no family members wants to come.
The doctors ignore the hardships and soldier on.
Yes, if we are comparing it with the October-November time, definitely it has increased because till that time we had, for a long period, we had 0 admissions. We had no patient in the hospital. But yes, now the number have increased little bit. So we cannot take it so lightly. And obviously people who are vulnerable age group, who have some comorbidities. So we have to be, even if we are fit, even if we are vaccinated, we have to take their care.
Stress on the healthcare system eventually means that the guardians of the healthcare system are also feeling the burnout. And this burnout will eventually lead to suboptimal level of patient care at hospitals that are feeling the heat at the moment as the COVID cases continue to surge. Apart from doing COVID duties, doctors are also human beings who go back to their families and face the trauma of having to see deaths at the hospital where they work. All these factors contribute to the mental stress that healthcare workers are currently facing. With Ajay Thakur in New Delhi, Milan Sharma for India Today.